Most families believe that once their aging loved one's admitted to the hospital, they're in good hands. There's doctors, there's nurses, there's high-tech equipment, and they can run all sorts of tests. They'll get to the bottom of what's going on and help that person. Here's our truth though. As amazing as our hospitals are, they're not designed to treat that one individual. And that's why you have to become an advocate and help them maneuver that process. So welcome to In-Home Senior Care. My name is Vitaly, and I'm glad you're here. And in this video, I'm going to give you my reasons for why advocating for your aging loved one is absolutely imperative when they're in the hospital. As a person ages, their body slows down. Everything becomes a little bit more confusing. I'm not talking about dementia. I am talking about just, eyesight is worse. Like as we age, those things change. And so why are hospital stays more challenging? Well, most of us wouldn't want to end up in the hospital. We don't want to go to the hospital, right? It's not like, why would we? And of course, if you're on your way to the hospital, something's not well, right? Something's going wrong, and you're in some ways potentially in some sort of altered state. And of course, as we know, seniors, or as we call them now, aging adults, are the ones most likely to end up in the hospital, again, because they're on many medications, they have multiple health conditions going on, and so they may struggle with more confusion, fatigue, fear, and again, the idea that they're going into the hospital, something's going on where they're not themselves to begin with, right? And so seniors in general have a hard time speaking up for themselves. They tend to want to not burden people, not be a nuisance, not be a pest, and so they don't want to ask too many questions and do different things. And so they may not fully understand what's happening, and they feel confused, and yet they may not speak up. And that's, why you need to step in and be that voice and be that advocate for them. Okay, so pause right here and just want to do a disclaimer. This video has nothing to do about bashing hospitals or anything negative about hospitals. Our hospitals are amazing. They do amazing work, and just the technology and the people and the teams, they are amazing. What this video is about is that you need to actually help those teams do their best by being able to be there and present the very best information and advocate for your loved one so that the outcome of that hospitalization is optimized, right? So keep in mind, hospitals are very busy places. Doctors rotate, nurses change shifts. The specialists all focus on their unique specialties. And so they're not set up to have anyone there to kind of see the whole picture of any one patient and to follow them, right? And so that's something where you will need to do that. So if your loved one may seem more confused, maybe they can't walk as good as they were, or again, maybe they're there because they actually have a fracture, or maybe they've got dizziness or something's going on, and part of that visit is to try to get to the bottom of what's actually happening. But a lot of these kinds of changes, they can be missed when there isn't somebody that can say, here's normal and here's where we are today. I'm not sure what happened, or maybe there was a fall. You're filling in that picture for what those the professionals need to know to be able to understand what are they trying to figure out and find out. So that, in a nutshell, is advocacy. And advocacy, or being an advocate, doesn't mean you're confrontational. Far from it. You shouldn't be. You should be there and very courteously, very nicely be able to advocate and ask questions. Ask questions means clarifying instructions that are being given, making sure they have all the information about your loved one. It means paying attention. It means kind of saying, hey, something doesn't seem right, like this doesn't add up, right? But just having somebody there to raise that. my mom is very different than what she usually is. Normally she's like this, and today she's very confused. Whatever those things are, you're helping them to understand that. Because when you know your loved one's baseline, you can deliver that information and help them, that team from the hospital, clue into the fact that this is what they're potentially dealing with. So you don't need medical training, obviously. You don't need to be a professional of some sort to do this, but you just need to be there, and you need to just be ready to speak up and help with that situation. Because when no one is actively advocating, risks can happen, mistakes can happen. Someone can be given a medication that they are allergic to. Somebody could be, they could be trying to diagnose and kind of going in one way when as a loved one who knows that person's history could say, no, this is, my mom actually has these things, right? So all sorts of things that may need to be helped with by having someone there. Hospital delirium, right, can be mistaken for dementia. So hospital delirium is a condition where because hospitals are always on, the lights are on, it's busy, the nurses are coming in, they're waking you up all the time. People who spend some time in the hospital can develop this just a confusion, right, where it's not their normal because they're not getting enough sleep, they're not really functioning well, they can be out of sorts and not be themselves. And so having you there as someone who knows them and knows that 2 days ago they were clear as a bell and today they're really off, most likely this is probably hospital delirium. Maybe there's other things as well, but it'll allow them to know that, yes, this person does not actually have dementia that we, have to think about. A discharge from the hospital can happen too quickly and without the, proper support set up, whether it's at home or maybe this person needs to go to rehab for a little bit. So these are not rare situations. This is something that we see fairly regularly. And I want to share a couple of stories for you that are personal to me. So my dad passed away about 7 years ago, but prior to that, probably about 2 years prior, he had a massive heart attack. It was second in his life, the second one. And he ended up with like a 15% function of his heart. He didn't go to the hospital. We was kind of trying to avoid that process. Well, anyway, by the time they cared for him, which they do a fantastic job, his heart was so weak, he essentially needed something done. He wouldn't be able to function. He wouldn't be able to walk around with that. Well, the hospital system we were a part of, or he was a part of at the time that was giving him care, basically had a doctor tell him, well, he's lived a good life. He's whatever he was, maybe 78 at the time or whatever, and basically that was it. And I just remember seeing the discouragement on his face, kind of giving this like you should just go home and die type scenario. And I remember having a conversation with him and saying, you know what, we're gonna do something different. We ended up transferring to a different hospital system who looked at him as someone who had value and offered him treatment options. And one of those options, and the one he ended up going with, was what was called a left ventricular assist device. It was a continuous flow pump that he had to have open heart surgery for, and was able to live for another couple of years. He actually ended up passing away from stomach cancer that wasn't related to any of this, but was actually able to make a full recovery. But my point is, I needed to be there and advocate for him. Now, in addition to that, while he was in the hospital and was recovering, because at that age, having open heart surgery is a challenging thing. My wife and I took turns. She spent most of that time being with him in the hospital, and there was a significant fear in him. So my dad is Ukrainian. I was actually born in Ukraine, came over here when I was 12. And so my dad spoke English, but he didn't, there's confusion, obviously. He didn't understand it as well as his own native language. So that combined with all sorts of things, because you're in a very vulnerable position when you're in your hospital bed, he wanted someone with him. It made a huge difference for him to have one of us there. But not only that, it's the advocacy, like I was sharing, of making sure that that hospital team knew what we needed, what his desires were. And again, this isn't an indictment of the hospital or of those professionals. They loved the idea of having someone there that could help them do their job better, right? Because they didn't know my dad, Greg, like we did, and we could help them fill in those holes. Second story I have is my wife's grandfather during COVID was hospitalized, and of course she was with him in the hospital, but we had to do a little bit of battling with the nursing team there because we got this, we have a new policy, we have no visitors. So, well, as an advocate, you're not a visitor. There's a difference. Visitors come and they just say, oh, hey, hope you're doing okay, I'll be praying for you, and they spend a little bit of time, bring some flowers, and they leave. An advocate, you don't have to be there all day to be an advocate, but an advocate plays a different role, and so just keep that in mind, that an advocate is not just someone who visits for a half hour or whatever. An advocate really is someone who is comforting the person who's there, giving them peace of mind that they're looking out for them and communicating back and forth and making sure that the outcome of that hospital visit is going to be as successful as possible. So just so you understand this, as I brought it up, the idea of my wife and her grandfather and her advocating for him, where we ran into a little bit of like, well, you can't be here because visiting hours are over, or we're not allowing visitors because of COVID. Your aging loved one has a legal right as a patient in a hospital to have an advocate for them. The official title, or what the Minnesota Hospital Bill of Rights calls it, is a designated support person. So I will put a link in the description to the Minnesota Hospital Bill of Rights. It's a good document for you to get yourself familiar with and to understand that you have that right to be there with them. They have a right to have you as their designated person so that you can speak on their behalf and help them to make sure that they're getting the best care possible. So please help them to feel safe and to get the best care possible. And then, as always, we are here and we would love to have a conversation with you. We would come out and visit with you, no cost, no obligation, just to help you figure out what the landscape looks like. We'd love it if you'd consider us for services, but ultimately we will help you connect with a provider that is the best fit for you. And as always, if this is helpful, please like, share, and subscribe, and we will see you in the next one.